Um, so this is the subjective investigation part. The video is broken down into different segments so that we can easily transfer the video to you. So I have performed my hand hygiene and I am now presented with the patient, and so I'll start with a consent. My name is Michael and I'll be your treating physiotherapist today. Hi.
Hello,
May I know your name, please?
my name is Steven.
Okay, Steven, my name is Michael and I'll be your treating physiotherapist for today. I just want to inform you that the interview will be done in different parts. There will be an interview where I'll get some questions. I'll be asking you some questions and also to verify the questions in your medical file. And after that, we'll proceed towards the objective investigation where I'll be carrying out some physical assessments that will involve you changing positions, and I'll be using stethoscopes and all that. And after that, we'll be doing treatments which will be in line with your goals. Do you give consent for all this to be done?
Yes, I do.
Thank you very much. And also, I have with me a supervisor who will be observing the section. As you know, this is an exam section. Are you comfortable with a supervisor being around?
It's okay.
All right. Thank you very much. Let's proceed to the question straight away. I understand that your main complaint for presenting in the emergency department is shortness of breath. Is that correct?
Yes.
Okay, so tell me about this shortness of breath. When I understand that you've been having this symptom for 2 to 3 years now.
Yes.
Has the symptom progressed over time?
Yes, it does.
So on the level of 0 to 10, 0 being no shortness of breath, 5 being the mid-level, and 10 being the shortness of breath that comes on slight exertion, on which scale can you place the shortness of breath you're having at the moment?
8/10.
8 over 10. That means it affects you on doing any slight activities. Okay, thank you very much. I also understand that so this shortness of breath now, can you actually say that it has really affected your activities and function?
Completely.
Completely. Okay. I also understand that you cough.
Yes.
You
I
haven't
do.
cough, and this cough has been ongoing for almost 4 to 5 years now.
Yes.
Okay, and most of the time it comes in the morning.
Yes.
Okay.
Very severe in the morning.
Okay, so and I also understand that you are now producing sputum, which is yellowish brown in color. Is that correct?
Yes.
Okay. Now tell me, how can you grade the quantity of the sputum? Is it like a tablespoon or a teaspoon when you cough?
It varies sometimes.
Okay.
Sometimes it can be a tablespoon. Sometimes it can be a teaspoon.
A teaspoon. Okay. So and it's worse in the morning.
Yes.
Okay. Do you get pains in your chest when you cough?
Yeah, severe pains, especially on the chest region.
On the chest region. Okay. Thank you. I would also like to know. I also know that you haven't. I just want to verify the information that you don't have any major past medical history. Have you been to any surgery, blood transfusion, accidents, fractures, or anything that required you to be admitted in the hospital?
Except for appendectomy, which I had when I think in my 20s.
Other than that,
Other than that, I've not got any past medical history.
and you are not on any medication at the moment.
Currently, no, but I took I had an inhaler
A year ago.
Yeah.
Okay. Apart from that, nothing. Okay. I also understood that you're a smoker and you smoke like a pack of cigarette and you've been doing that for 40 years.
For a very long time, yes.
Okay. Do you mind me asking if you actually know the effects of smoking on people's respiratory system?
I don't mind.
Okay, so do you actually know that smoking is not really good for someone's health?
Yes, I do, but sometimes when habit becomes a culture,
Yeah.
you tend to forget some health hazards associated to it.
All right. So I understand that. I would also like to ask, are you, do you mind if we talk about quitting?
It's okay.
Okay. Because there are a few help that you can get if you really want to quit. do you mind if I discuss that with your general practitioner so that he can carry on with that?
Yes, it's fine.
Okay, thank you. I'll relay the information to your general practitioner
All
because
right,
he's got more
thanks.
information.
Thank you.
Don't worry. Um, okay, so apart from that, tell me, how is your breathing? Do you most of the time do you get labored breathing? Is it hard for you to breathe?
A lot of times, yes, it's very difficult, and you know, sometimes some positions are very painful when I breathe. For example, if I'm walking, I find breathing difficult. But the way I'm leaning like this, I think I feel a bit comfortable,
Okay.
but I still feel pain. I
Okay.
think position affects breathing for me.
All right. Thank you.